Good day, everyone. This is Mark Vella, and you're listening to Headline News. 55 people died in U.S. after receiving COVID-19 vaccines, 96 in life-threatening condition. The U.S. federal government's Vaccine Adverse Event Reporting System, or VAERS, released data on Friday, January 15th, showing shocking results after being vaccinated against the CCP virus, or COVID-19, in the United States. At this time, 10.5 million Americans have been vaccinated. However, data from VAERS shows that in addition to 55 deaths, 96 people had life-threatening illnesses. 24 people were permanently disabled, and 225 people were hospitalized. The system says there have been deaths from both Moderna and Pfizer vaccines, with some patients dying days after receiving the vaccine. And the system's reports may have documented only a small percentage of adverse events following the vaccination. It is not clear whether these adverse events were triggered solely by vaccination. Nancy Messonnier, director of the CDC's National Center for Immunization and Respiratory Diseases, said January 6 that the virus vaccine averages out to a rate of 11.1 anaphylaxis cases per 1 million doses administered, which is higher than the 1.3 per 1 million due to the flu vaccine. However, she has also said that these are safe and effective vaccines. We have good data to show that. For its part, Pfizer said there is no evidence that these deaths are directly related to the vaccine. Pfizer said in a statement, "To date, millions of people have been vaccinated, and we are closely monitoring all adverse events in individuals receiving our vaccine. It is important to note that serious adverse events, including deaths that are unrelated to the vaccine, are unfortunately likely to occur at a similar rate as they would in the general population." CDC reports a more highly transmissible variant of the CCP virus detected in 10 states. At least 10 state health departments in the United States have detected the highly contagious B.1.1.7 variant of COVID-19, the disease caused by the CCP, Chinese Communist Party virus, according to a new report. The U.S. Centers for Disease Control and Prevention, CDC, in an update on January 15th, said that a more highly transmissible variant of SARS-CoV-2, B.1.1.7, has been detected in 10 U.S. states. SARS-CoV-2 is another name for the coronavirus that is believed to have emerged in Wuhan, China in late 2019. Health officials warned that models have shown the B.1.1.7 strain of the virus has the potential to increase the U.S. pandemic trajectory in the coming months and warrants universal and increased compliance with mitigation strategies, including distancing and masking. In the United States, the strain was first reported by state authorities in a rural area in Colorado, hours away from Denver. Other than Colorado, the B.1.1.7 variant was discovered in Pennsylvania, New York, Illinois, California, and more, according to reports published in recent weeks. The modeled trajectory of this variant in the U.S. exhibits rapid growth in early 2021, becoming the predominant variant in March. Increased SARS-CoV-2 transmission might threaten strained healthcare resources, require extended and more rigorous implementation of public health strategies, and increase the percentage of population immunity required for pandemic control, said the CDC. Further, strategic testing of persons without symptoms of COVID-19, but who are at increased risk for infection with SARS-CoV-2, provides another opportunity to limit ongoing spread, according to the CDC. Collectively, enhanced genomic surveillance, combined with increased compliance with public health mitigation strategies, including vaccination, physical distancing, use of masks, hand hygiene, and isolation and quarantine, will be essential to limiting the spread of SARS-CoV-2 and protecting public health. Among the possibilities, the ability to evade vaccine-induced immunity would likely be the most concerning because once a large proportion of the population is vaccinated, there will be immune pressure that could favor and accelerate emergence of such variants by selecting for escape mutants, the CDC said. There is no evidence that this is occurring, and most experts believe escape mutants are unlikely to emerge because of the nature of the virus. This variant was first reported in the UK in mid-December, although the CDC noted that it may have emerged in September 2020. Meanwhile, B.1.1.7 has been detected in more than 30 countries, the agency said, while adding that it is easier to transmit than other CCP virus strains. UK authorities said last year that the new variant of the virus was the reason for the increase in infection rates in London and southeastern England. Black Lives Matter leader has been released without bail. John Sullivan, an agitator and activist of the Black Lives Matter organization, was released conditionally without bail on Friday, January 15th, after he was arrested and charged on the day prior to his alleged activities in the U.S. Capitol amid the breach of the building. The Department of Justice announced on January 14th that Sullivan, aged 27, was arrested on the same day in Utah and charged with being on restricted grounds without authority, violent entry and disorderly conduct, and interfering with law enforcement. DOJ prosecutors allege that he entered the U.S. Capitol through a window, pushed past Capitol Police once inside, and admitted to filming and being depicted in video footage that shows him present outside of the Speaker's lobby within the U.S. Capitol at the shooting of a woman by the U.S. Capitol Police officer. The woman was identified as Ashley Babbitt, an Air Force veteran. Sullivan made his first appearance in court via a virtual hearing in Salt Lake City on January 15th. Magistrate Judge Daphne A. Oberg of the United States District Court for the District of Utah said that the DOJ did not meet the legal threshold to get a detention hearing, reported Inner City Press, noting that the DOJ did not file a detention memo. "We seek detention, but we want 3 days," said Assistant U.S. Attorney Brian Reeves at the hearing, according to the outlet. Reeves had argued that Sullivan should remain in custody until the legal case resolves, alleging that Sullivan thrives at inciting chaos, the outlet reported. Reeves also noted there are reports of plans for armed protests at all 50 state capitals and in Washington ahead of January 20th as a valid reason, among others, to keep Sullivan behind bars. However, Judge Oberg refuted that first you have to meet the threshold for a detention hearing. Sullivan was released under the condition that he surrenders his passport, wears a GPS monitor, undergoes a mental health check, and remains home unless for court-approved activities, including work, religious services, and medical treatment. Sullivan is also prohibited from possessing firearms. He also has to maintain or seek full-time employment and stop working for Insurgents USA, an activist group he founded, although he doesn't have to surrender control of the group. Judge Oberg ordered that Sullivan remain off social media before his pre-trial and be put under strict internet monitoring. She also said that any violation of the bail conditions would not be taken lightly, reported Deseret News. This concludes today's broadcast. Thank you for your time, and stay tuned for the next Headline News.